We'll go to our next question. It's Michael Bociurkiw, who is a contributor to CNN. Michael?
Okay, great. So greetings from Kiev. I'm here today. Dr. Tedros mentioned the climate crisis. Recently in my home province of British Columbia, we saw that unprecedented heat wave resulted in hundreds of sudden deaths. And there was delayed and poor public messaging, few cooling centers, and other shortcomings. My question is the following: whether there's a feeling that elected leaders coming out of this pandemic are taking on board a Build Back Better approach, not only when it comes to handling future pandemics, but things like climate emergencies, absorbing lessons learned, instituting better public health messaging. And I'll just read you very quickly, sorry, Tadek, one quick line that I wrote. I said, perhaps it was naive to expect humanity to turn a global crisis into an opportunity. A virus, a pandemic, was a once-in-a-lifetime chance to unite against a common enemy, to embark on a process of building back better on contentious issues like fighting climate change. I'm wondering of your thoughts. Thank you.
Thank you, Michael. So the question is about building back better. Maybe Maria, you can start, and I think we should also hear from Prime Minister on this question.
Yes, thank you very much. Thanks, Michael, for the question, and nice to hear your voice again. I mean, I think on the positive side, we are seeing some changes that are being made to be better prepared for the next one. I think we should not mince words to suggest that there won't be a next one in terms of the next emerging pathogen or re-emerging pathogen, the next pandemic. But I would have to be honest and say it's not enough. We are seeing a lot of countries using the current situation that we are in with COVID-19 and the trauma that all of us are facing because of this virus, the upheaval that all of us in all of our lives have experienced. And not enough, I would say, is being done to build the fundamental systems that we need in public health, the surveillance systems that we need, the testing systems that we need, including the use of novel testing that is coming online, the antigen-based tests that are there, the new technologies that are being advanced. We need more investment in our health and care workers around the world to ensure that we have more people who are trained appropriately, who are provided the protection that they need to carry out the life-saving work that they do every single day, to support more community health workers who are the foundation of public health in so many countries around the world. There needs to be much more of that. I think we need to do much more in building trust with our communities and keeping that trust, working hard to keep the trust of our communities, building the leaders, engagement, much more engagement with community leaders, with religious leaders, with women, with youth, to be able to harness the energy and the innovation that we have for any of the challenges that we see going forward. And I think we need much more on the partnership side, the supply chains that were broken, that are being so hard. So many partners are working to rebuild, to be able to, once we do have supplies, to ship those supplies. And the partnerships that we have through R&D. I think the R&D side has been a real shining light in terms of this pandemic, but again, we need more. So I think the short answer is not enough, if I'm being honest, but I do want to be positive that it's not too late. My biggest worry that I have right now is that we don't use this current situation to make those changes. If we quote unquote wait until this pandemic is over, we won't do it. So we are seeing countries, and what we've learned from this COVID-19 pandemic is the countries that had experience with other infectious diseases across Asia and Africa, and diseases like MERS, like SARS, like avian influenza, Ebola, I could go on and on. They built those systems over decades. And preparedness is a constant. It is not a start and stop. It doesn't stutter. It's a constant. It needs constant investment in terms of energy, political will, financing. And the money is there. We see it. We see the money being raised for COVID-19. That is something that really, really needs to be invested in going forward. I'm sure others will want to talk about healthcare, access to healthcare, and climate, but we could probably spend the next hour on that answer. But I really want to emphasize it's not enough. So let's turn that around. and really put that emphasis in, and all countries need to be doing this.
Thank you very much, Dr. Van Kerkhove. Maybe Prime Minister would like to add something on the issue of building back better and turning this pandemic into opportunities. Your Excellency?
Thank you very much, Excellency. Evidently, there was not sufficient effort in building resilient public health institutions prior to COVID. And I would say that one of the positive outcomes of COVID is that most countries are now focusing on building greater health resilience to scale up their institutions, ensure that they have the supporting health institutions and the equipment, the technology, and even the staffing to deal with future pandemics. In fact, it was predicted decades ago that we would have been faced with a pandemic at some point, but evidently the issue did not get a lot of traction globally. So COVID-19 has now forced us to address the issue of health resilience within our respective states. And you recognize too that when this pandemic, or when this virus first surfaced, many global leaders were not taking it seriously. But again, the devastation to lives and livelihoods would have forced all of us as leaders globally to address the issue and also to build out our health infrastructure to ensure that we're better prepared for the next pandemic. And we know too that one of the consequences of climate change is the fact that more pathogens will be released, and the likelihood of having future pandemics within a shorter period of time, maybe every several years, every decade, is likely. And that is one of the reasons to why we have to prioritize the issue of climate change in order to protect the planet, and at the same time, even to control or to reduce or eliminate, for that matter, the pandemics that may follow in the future. But perhaps the most significant lesson as a result of this pandemic is the need for global collaboration and recognizing to the extent of our vulnerability, that we are as vulnerable as the weakest link. So, those are positive areas of development for future strong global collaboration to deal with these pandemics in the future. And obviously to prioritize research and development and to make the necessary resources available. And we'd have seen, for example, that in the development of the COVID vaccines, that wealthy countries in particular would have allocated an enormous amount of resources in order to bring safe and efficacious vaccines to market within the shortest period of time. So again, I think that there have been some good lessons, and as we realign and certainly adjust, I'm quite sure that we'll be better prepared to fight future pandemics and perhaps reduce the extent of the economic and social damage that we'd have experienced from COVID-19.
Many thanks, Your Excellency. Dr. Tedros?
Yeah, just wanted to add, while agreeing with what Prime Minister said, the virus is a common enemy, and that's why we have to fight it in unison. And this virus, this pandemic, has also shown us the centrality of health. And that's why investment in health will be very important. And then if you take climate change, it's the same. It's a common problem that affects the whole world. But it also disproportionately affects the island countries, small islands especially, more than any part of the world, although it's a problem for the whole world. When you see it in terms of islands, there are some projections, some islands may submerge. It's a matter of survival. But even if we say the projections are right and some countries could submerge, could be below sea, but it's only a matter of time until climate change affects others who are not an island, which is big countries or mainland. So it's a common problem. And when I come back to the question from Michael, the political commitment, I think, is necessary. But this is a matter of survival for the world. And if that cannot trigger political commitment, if the real and clear danger cannot provoke or bring political commitment, I cannot understand what else can bring commitment. And we have seen, by the way, during this pandemic, many countries were reporting that their ecology or their environment actually improving because of less interference and probably less pollution and so on. So it's a common problem. It's a matter of survival for the whole world. It's not the problem of the small island countries only. So that means it's everybody's problem. It's everybody's, and the solution is everybody's solution. And having a real commitment will be very, very important from all leaders